Hello, it's Dr. Rhonda Johnson, and today is Wednesday, August 18th, 2021. And today I'm going to be clarifying what's going on with the COVID vaccine boosters. So I'm going to first start off by talking about for the immunocompromised and fully vaccinated group. Last week, on August 13th, the FDA authorized the use of a third dose of either the Pfizer or Moderna vaccine for those immunocompromised individuals who were fully vaccinated. And in these individuals, they may not have mounted a sufficient immune response to their previous 2 doses of the vaccine, and they may need extra protection against COVID-19. So, according to the FDA guidance, the authorization for the third booster shot for Pfizer and Moderna vaccines for the immunocompromised can be given at least 28 days after the last 2-dose regimen. And for people who got Moderna, that's 18 years old and up. And for those who got the Pfizer and who may be immunocompromised, those are individuals who are 12 and up. Now, no doctor's prescription is required for that third shot. But again, people may want to check with their doctor if they're unsure or have questions. Now, I want to emphasize that you have to get the same vaccine that you originally got for the first dose. So if you got 2 doses of Pfizer, your third booster dose, if you're immunocompromised, needs to be Pfizer. And the same thing with Moderna. If you got 2 doses of Moderna, your third dose needs to be a Moderna booster if you're immunocompromised. Now, many people are asking, well, who is immunocompromised? Well, currently the CDC says this includes people who have been receiving active treatment for cancer or tumors or cancers of the blood, those who have received an organ transplant and are taking immunosuppressive medication, people who have received a stem cell transplant in the last 2 years and are on medication to suppress their immune systems, people who have moderate or severe primary immunodeficiency disorders. Those are people with DiGeorge syndrome or Wiskott-Aldrich syndrome, people who have advanced or untreated HIV infection, and those folks who are being actively treated with high-dose corticosteroids or other drugs that may suppress your immune system. Now, again, this is a immunocompromised group. There are a lot of things that can cause your immune system to be compromised. Please check with your doctor if you are concerned about having a diagnosis that renders you immunocompromised. In addition, people who are close contacts of those who are immunocompromised need to be vaccinated to lower their risk to their loved ones. Now, second group of folks are those who are fully vaccinated and not immunocompromised. That's everybody who got the doses of the Johnson & Johnson, Pfizer, and Moderna. Let's talk about that group. Pretty soon the government, any day now, is expected to issue recommendations regarding booster doses for what I'll call the general public, those who got the vaccines and aren't immunocompromised. Now, why get a booster dose? Because the data is showing that immunity falls off over time, and the vaccines may not be providing enough coverage for these new COVID variants. So stay tuned for the government to issue recommendations. Advance notice on the news basically has said that the recommendation is going to be 8 months after your second dose. But again, stay tuned. Now, the third group are those who got the Johnson & Johnson single-dose vaccines. Now, the FDA and the CDC are actively working to determine guidance for individuals who received the Johnson & Johnson vaccine. So as of today, additional boosters for people who received an initial dose of Johnson & Johnson vaccine are not authorized at this time. That includes even for the immunocompromised folks. So I hope that provides an explanation which is a little easier to understand. Now, I want to also speak to those who haven't been vaccinated, who haven't gotten a single dose of the COVID vaccine, people who are undecided, and people who are opposed. Folks, you need to be prepared to get infected with the Delta variant, especially if you're not wearing a mask, socially distancing, or frequent hand washing. The Delta variant now is the cause of 97% of all U.S. infections, and over 200,000 people are testing positive in the United States every day. You need to know the symptoms of COVID infection. You need to know where you can get tested if you show symptoms. You need to have supplies in your household. You need to know how you'll plan and manage your isolation and quarantine for 10 days and arrange for care of your children if you get hospitalized and sick, if that applies to you. Lastly, those who are thinking about selling and receiving fake COVID vaccination cards, just know that that's illegal and you can be subject to fines and up to 5 years in prison. Remember, folks, the real COVID vaccines are free to U.S. Anyone living in the United States. You can get a real COVID vaccine and a real COVID vaccination card for free, and you won't go to prison for a fake card. If you're not sure where to get the COVID vaccine, text your zip code to 438-829, and you'll get a text with at least 1 or 2 provider locations and information on which vaccine is being provided. That's my message for today. As always, my views are my own. I hope that you will continue to stay informed and stay safe. And as always, have a blessed day.